Objection.
Mr. President, just a few minutes ago, I had a visit to my office of 4 young people from the state of Illinois. They were of a variety of different ages, from 10 years of age until the age of 17. They all came because they had a similar life experience and they wanted to share it with me. Each one of them had been diagnosed with type 1 diabetes. And little Owen, 10-year-old Owen from Deerfield, told his story. The cutest little kid, great reader, read me a presentation which he put together. And the young women who were with him all talked about how their lives changed when they learned at the age of 7 or 8 that they had type 1 diabetes. And for each one of them, from that point forward, insulin became the lifeline. They had to have access to insulin, and they had to have it sometimes, many times a day, in the middle of the night, and reached a point where, through technology, they had continuous glucose monitoring devices and pumps that were keeping them alive. But every minute of every day was a test to them as to whether or not they were going to get sick and need help. It was a great presentation by these young people whose lives were transformed, and their parents who were hanging on every word as they told me their life stories. And they brought up 2 points which I want to share on the floor this morning. The first is the importance of medical research. As one young woman said, she's about 17 now, she's lived with this for 8 or 9 years, and she said she's a twin, and her brother told her when she was diagnosed that he hated the thought that as an old woman, she'd still be worried about her insulin every single day. And she said, I told my brother, we're going to find a cure before I'm an old woman. Well, I certainly hope that that young girl is right. But she's only right if we do our part here on the floor of the United States Senate and not just give speeches. What we have to do is appropriate money to the National Institutes of Health. It's the premier medical research agency in the world. And we've had good luck in the last 4 years. And I want to salute 2 of my Republican colleagues and one of my Democratic colleagues for their special efforts. For the last 4 years, Senator Roy Blunt, Republican of Missouri, Senator Lamar Alexander, Republican of Tennessee, and Senator Patty Murray, Democrat of Washington, have joined forces, I've been part of that team too, to encourage an increase in medical research funding every single year, and we've done it. The increase that Dr. Collins at NIH asked for was 5% real growth a year. That's 5% over inflation. You know what we've done in 4 years? The amount at NIH has gone up from $30 billion to $39 billion. Dramatic. 30% increase in NIH research funding. And we're going to have a tough time with this coming budget, as we have in the past. But I hope that we really reach a bottom line as Democrats and Republicans that we are committed to 5% real growth in medical research every single year, so that we can answer these young people who come in dealing with diabetes, those who are suffering from cancer, heart disease, Alzheimer's, Parkinson's, the list goes on, that we are doing our part here in the Senate. That despite all the political battles and differences, there are things that bring us together, and that should be one. The second thing they raised, one of the young girls there, Morgan of Jerseyville, started telling me the story about the cost of insulin. The cost of insulin. And as she was telling me the story and the sacrifices being made by her family to keep her alive, she broke down crying. What she was telling me was her personal experience, her family experience, was something that every family with diabetes knows. The cost of insulin charged by the pharmaceutical companies has gone up dramatically, without justification, over the last 20 years. In 1999, one of the major insulin drugs called Humalog, made by Eli Lilly, was selling for $21 a vial. That's 20 years ago. 1999, $21 a vial. The price today, $329 a vial. What has caused this dramatic increase? There's nothing that's happened with this drug. It's the same drug. And I might add, Eli Lilly of Indianapolis, Indiana, is selling the same insulin product, Humalog, in Canada for $39. $329 in the United States, $39 in Canada. And these families told me they were lucky to have health insurance that covered prescription drugs, sounds good, except they each had large copays, $8,000 a year. And what it meant was that for this young girl, this beautiful little girl who was in my office with juvenile diabetes, they would spend $8,000 a year at the beginning, the first 3 months of the year, for her 3 months of insulin before the health insurance kicked in and started paying for it. And of course, our families aren't so lucky. They don't have health insurance to pay for their drugs. So what are we going to do about it? It happens to be something the United States Senate is supposed to take up. We're supposed to debate these things and decide the policy for this country. We'll see. And very soon we'll have a chance. A bill's coming out of the HELP Committee, Health, Education, Labor Committee, Pensions Committee, and we'll have a chance to amend it on the floor to deal with the cost of prescription drugs. I'll have an amendment ready. My colleagues want to join me, I hope they will, on the cost of insulin. And we'll have a chance, if Senator McConnell, the Republican leader, will allow us, it's his decision, we'll have a chance to decide whether these kids and their families are going to get ripped off by these pharmaceutical companies for years to come. And it isn't just insulin, it's so many other products. It's time for us to stand up for these families and their kids, to put the money into medical research, and to tell Pharma once and for all, enough is enough. Insulin was discovered almost 100 years ago. What you're doing in terms of increasing the cost of it for these families is unacceptable and unconscionable.